Good morning, everyone. I'm Riley King, and welcome to my morning news report right here on the Riley King Network. Let's begin. Test report delay boosts New Hampshire to highest single day total of COVID 19 cases. 252 new cases, 2 more deaths reported in New Hampshire. New Hampshire reported 252 new cases of COVID 19 Thursday, the highest single day total ever. But health officials said many of those cases should have been reported Wednesday. Yes, on Wednesday, not on Thursday. State epidemiologist Dr. Benjamin Chan said there was an issue with reporting at one of the national labs, which resulted in the delay of about 50 cases being reported a day late. Still, he said, the state is averaging about 150 new infections each day, a sign that community spread of coronavirus is increasing. 2 more Granite Staters have died of COVID 19, Chan said. He said neither was associated with long-term care facility. There have been 486 deaths in New Hampshire linked to COVID 19. Chan said substantial community spread is being seen in 7 New Hampshire counties: Coos, Grafton, Belknap, Stratford, Merrimack, Hillsborough, and Rockingham. The other 3 counties, Carroll, Sullivan, and Cheshire, are moderate level of community spread. Chan said the continuing spread of the virus shows that mitigation measures must continue to be followed, avoiding large gatherings, wearing a mask, and maintaining distance will help prevent the spread of the coronavirus, he said. Chan said families will need to make careful decisions about what they deem safe, but there are ways of mitigating the risk. It's all a spectrum of risk, Chan said. Eating indoors is probably more risky than eating outdoors, which is more risky than getting takeout and eating at home. But there are steps that businesses can and should take to minimize and reduce the risk so that people can feel comfortable. Despite numbers rising across New England, Governor Chris Sununu said the state is not yet planning new travel restrictions or any border changes. The fact that our contact tracing is so specific allows us to be very surgical, very precise about where we can tighten things up or create more options. Sununu said the best example is probably hockey. Unlike at the beginning of the pandemic, when the coronavirus was mainly spreading in outbreaks associated with long-term care facilities, Chan said the virus is now spreading mostly in the community. He said people are getting tired of the pandemic and want to get out more and see family and friends, but that is helping the virus spread. The North Country is also seeing a lot of new cases, a taste of things to come. I don't think this is a blimp, Health Commissioner Lori Shipperton said. I think we're seeing substantial community transmission in a lot of our communities now, rural and population centers. And I think that is what we expect to see through fall into winter, until we have a vaccine vaccination come through. Chan said 204 of the new cases were confirmed with a PCR test and 48 were confirmed by antigen test. The state's daily PCR test positivity rate was 1.8%. There are 1,546 active cases of COVID-19 cases in the state. Chan said the 14-day statewide infection rate is 123 per 100,000 population. One new hospitalization was reported, and there are 44 people currently hospitalized for COVID-19 in the state, Chan said. 2 new outbreaks at long-term care facilities were reported. Shipperton said 8 residents and 7 staff members at St. Anne's Rehabilitation and Nursing Center in Dover have tested positive for COVID-19. 8 residents and 3 staff members at Woodlawn Care Center in Newport have also tested positive. There was also an outbreak at Mountain Prospect Academy, a residential youth treatment center in Plymouth. Shipperton said 9 residents and 11 staff members have tested positive. And that does it for this news report right here on the Riley King Network. I hope you all have a great rest of your day, and I'll see you back here later on today for another news report. Goodbye, everyone.